Hey fellow lab rats, this is Rebecca from the Lab Rat YouTube channel. In this video, I'm going to be talking about the equipment that we use for venipuncture procedures. This is a part one of a two-part lecture series. Please don't forget to like this video and subscribe to my channel for more educational laboratory content. So after watching this lecture recording, you'll be able to do the following. You'll be able to discuss the use of a blood collection tray, drawing stations, and mobile phlebotomy workstations. You should be able to list all the items that a phlebotomist must carry on their blood collection tray. You'll be able to differentiate among the various safety needle sizes in terms of gauge, length, and purpose. You'll be able to describe the correct methods to safely dispose of used needles. You will be able to differentiate among an evacuated tube system, a syringe system, and a winged blood collection set. In addition to differentiating between these systems, you will be able to state the advantages and disadvantages of each. You'll also be able to identify the types of evacuated tubes by color and be able to state the anticoagulants and additives present and any of their specific characteristics that they may have and, of course, their purpose. Additionally, after watching this lecture recording, you will be able to state the mechanism of action, advantages, and disadvantages of the anticoagulants EDTA, sodium citrate, potassium oxalate, and heparin. Additionally, you will be able to list the correct order of draw when collecting these tubes of blood. You will also be able to describe the type and the purpose of tourniquets. Also, you'll be able to name the substances that are used to clean a patient's skin before venipuncture, as well as the use of gauze, bandages, gloves, and slides when performing a venipuncture procedure. You'll be able to describe the quality control of the venipuncture equipment, and lastly, you'll be able to correctly select and assemble venipuncture equipment when presented with a clinical situation. There are several key terms associated with Part 1 and Part 2 of this lecture series. These are acid citrate dextrose, or ACD, additive, anticoagulant, antiglycolytic agent, antiseptic, bevel, clot activator, ethylene diamine tetraacetic acid, or EDTA for short, evacuated tube, gauge, heparin, holder, hub, and hypodermic needle. These terms will all be discussed between Part 1 and Part 2 of this lecture series. More key terms between these two presentations are lumen, multi-sample needle, plasma preparation tube or PPT, plasma separator tube or PST, polymer barrier gel, potassium oxalate, rapid serum tube or RST, serum separator tube or SST, shaft, silica, sodium citrate, sodium fluoride, sodium polyethyl sulfonate or SPS, and winged blood collection set. Like on the previous slide, these are terms that we will be discussing between Part 1 and Part 2 of this lecture series. Okay, so now that we've identified both the learning objectives and the key terms for this lecture series, let's get to the lecture. So on this first slide, we're going to be discussing venipuncture equipment. So you all are embarking on your journey to become phlebotomists, and venipuncture is, of course, the core of what you'll be performing on the job. We all know what venipuncture is, so it's the puncture of a vein to withdraw a blood sample, usually for laboratory testing. So this here is a list of equipment that you will need for drawing a patient's blood. There are two main areas where you'll be performing the venipuncture procedure: in a laboratory collection area or in a patient's room. If in the laboratory collection area, there will be a table that holds all of your supplies. If you're traveling to a patient's room for collection, you will have a collection tray, which holds all of the needed supplies for the procedure. The evacuated tube system is the most commonly used means of collecting specimens. It consists of a plastic holder, the evacuated sample tube, and a double-pointed needle. One end of the double-pointed needle enters the vein, and the other end pierces the top of the tube. Once the vein is punctured, the vacuum inside the tube aspirates the blood. The evacuated tube system reduces the risk of direct exposure to the patient's blood and has made it easier for phlebotomists to take multiple samples from a single venipuncture stick. Winged collection sets, which are also called butterflies or butterfly needles, are hollow needles that have plastic wings on either side of them, used to access the vein with tubing that is attached. Butterflies are used on people who might be difficult to perform venipuncture on, including like the elderly, infants, children, and people who are difficult sticks. Needles, of course, are also needed for phlebotomy procedures. Sharps containers are made from rigid plastic that have a tight fitting and puncture resistant lid and are leak resistant. Needles and other sharps are required to be disposed in a sharps container to prevent needle sticks from happening. A transfer device is utilized to relocate blood from a syringe into an evacuated tube. A tourniquet is used to help make the veins more visible. Gloves are a form of personal protective equipment, or PPE, that must always be worn when performing a phlebotomy procedure. And due to latex allergies, latex-free gloves should be worn to prevent reactions in patients. Now, the standard antiseptic for routine venipuncture is 70% isopropyl alcohol. Chlorhexidine is used for blood donors and blood cultures, but not for routine venipuncture. So these are all the equipment that you'll need to perform a venipuncture procedure. Additionally, you'll also need a 2x2 inch gauze pad or gauze pads when performing a venipuncture procedure. So this is used to hold pressure at the site once the venipuncture is performed to stop the bleeding. Bandages and wraps are used to prevent bleeding after the venipuncture. Antimicrobial hand gel or a hand washing sink should be available to disinfect your hands between each patient. A pen, of course, that has ink that won't run when it gets wet, such as a ballpoint pen, is good for using on patient labels that go on the tube. So proper patient identification on blood samples is of critical importance in venipuncture. So we definitely don't want the names we write on the tubes to run. So these last two slides, again, are the equipment that is needed to perform the venipuncture procedure. Now let's talk about the organization of all of that equipment that we talked about. So it's important for all of your venipuncture equipment in your phlebotomy tray to be organized. Each organization you work in will have a standard way of organizing phlebotomy trays, which will be carried to the patient if you're going to their room. It's very important that we keep these organized in the standard way that your organization dictates. This keeps the supplies from becoming outdated and ensures that you have what supplies you need to collect samples when away from the laboratory. And as a note, the tray should not be placed on the patient's bed or food tray, as this is an easy way to spread infection from patient to patient. So the photo on the right-hand side of this slide shows a typical phlebotomy tray that is fully stocked. These photos show a mobile phlebotomy workstation. These are becoming more common in hospitals and emergency room departments. These have wheels on the bottom so they're easily transported and eliminate the need to find an appropriate place to place the phlebotomy tray in the patient's room. So if you can see here on the top here, there are some computer screens that has access, to the patient's file, so that way the phlebotomist can print off labels for them. And then you can see these desk drawers essentially are pull out underneath the computer, and that is all the organization of the supplies in there. So these are mobile phlebotomy workstations. So the phlebotomy trays and the mobile phlebotomy workstation are used for drawing patients that are in a hospital room. So the phlebotomist goes to them to draw their blood. In a laboratory draw station, patients come in an outpatient setting to a phlebotomist that stays in one area. So this is a permanent setting. A patient chair is, of course, required at these draw stations. There are many types of phlebotomy chairs. So blood donors, so these are the people that are coming to a blood donation center that are having a bag of their blood drawn to give to people needing a blood transfusion. So typically, these type of patients have reclining chairs available for them. And this is just because their phlebotomy procedure requires a lot more blood to be taken from them than a normal phlebotomy procedure used for laboratory testing. So these reclining chairs are more comfortable for the patient and can be reclined for relaxation, and also if the patient is having a reaction or feels faint. So normally outpatient draw stations have regular drawing chairs. They have an arm that comes across the patient that prevents falls from the patient in case that they faint. So this chair on the right-hand side of this slide shows just a normal outpatient draw station with a regular drawing chair. It's very important that all trays, workstations, and phlebotomy equipment must be well stocked, clean, and disinfected regularly. Okay, so let's talk a little bit about the evacuated tube system, or ETS. So the evacuated tube system is the most commonly used means of collecting specimens. It consists of a plastic holder, the evacuated sample tube, and a double-pointed needle. One end of the double-pointed needle enters the vein, and the other end pierces the top of the tube. Once the vein is punctured, the vacuum inside the tube aspirates the blood. The evacuated tube system reduces the risk of direct exposure to the patient's blood and has made it easier for phlebotomists to take multiple samples from a single venipuncture stick. There are a variety of different evacuated tubes, and each tube type is color-coded depending on what type of additive is present within the tube, and we'll discuss this later on. The image on the left-hand side of this slide shows a double-ended needle that's used in the evacuated tube system that happens to just be not in its holder. So on the top part of the image, you can see a needle that has two caps. So this is how they come to protect anyone from getting stuck accidentally. So one of the caps is gray. It can also be clear as well. And the other cap is colored. In this specific picture, the colored cap is green. So the gray cap is the cap that you remove first to reveal the part of the needle that goes into the holder. So you remove that cap and then place that needle into the plastic holder and twist it until the holder stops. So this will attach that double-ended needle into the holder. So it's important to not be aggressive with the tightening. It tightens very easily. So now the green colored cap covers the needle that will go into the patient's vein. This cap should not come off until the venipuncture site has been cleaned and the tourniquet is in place. So the gray capped needle part goes into the clear holder. So clear to clear, gray to clear. Hopefully this helps you remember it. So the picture on the right-hand side shows all the parts of the evacuated tube system. You can see the needle, the safety shield, and the clear bluish colored holder. Then a red-topped evacuated tube. The purpose of the holder is to hold the evacuated tubes, hold the needle, and prevent you from touching the needle. And of course, the evacuated tubes collect the blood samples. There are a variety of different needle types that we use for venipuncture procedures. Multi-sample needles are those used in the evacuated tube system and allow for several samples to be taken with a single puncture. Hypodermic needles are hollow needles that attach to a syringe for collection. Winged collection sets, which are also called butterflies or butterfly needles, are hollow needles that have plastic wings on either side of them, used to access the vein with tubing that is attached. So butterflies are used on people who might be difficult to perform venipunctures on, including the elderly, infants, and children, and also people who are considered difficult sticks. Needles vary in length from 1 to 1.5 inches long. The needle gauge is the inner measurement of the opening of a needle. So needles vary in gauge size as well as length, and gauges 21 to 23 are commonly used for routine venipuncture. The needles we use for venipuncture are sterile, single-use, and disposable. The lengths of the needles vary from 1 to 1.5 inches for routine venipunctures and 0.5 to 0.75 inches for winged blood collection procedures. The needle gauge is the inner measurement of the opening of the needle. Now, the smaller the gauge number, the bigger the needle diameter is. So a 16 gauge needle is very large and are used for blood collection procedures for blood donation. And 23 gauge needles are small. So we can be using these for patients that have small, fragile veins. So again, needles are sterile. So this means it has been treated either with chemicals or heat to destroy all organisms on it. Since needles are used to puncture the skin, it's critical that they remain sterile to prevent the spread of infection into the patient. The color of the cap of the needle is standardized and tells you the gauge of the needle. The green cap over the needle means the needle is a 21 gauge needle. The black cap means that the needle is a 22 gauge needle. On the photo on this slide, you can see both green and black cap needles. You can also see in this picture the manufacturer's seal and the center of the needle. Because needles need to be sterile when they are used on a patient, it's imperative that needles not be used if the manufacturer seal is broken. Additionally, it is now required that all needles have a safety device on them. The needle in the middle of this picture has a pink-colored safety device. This is activated once a blood draw has been completed. It serves as a resheathing device, meaning it provides a shield that covers the needle after use to prevent needle sticks. Before removing the colored cap, the needle should be secured into its holder. The patient arm should be prepared, and a tourniquet should be on, and the safety device must be lifted out of the way. The parts of the needle include the bevel, shaft, lumen, and hub. The bevel is the slanted tip of the needle that is slanted to create a slit into the skin. The shaft is the long, slender stem of the needle. The lumen is the opening inside the needle where the blood flows in. And the hub is the part of the needle that attaches to the syringe or holder. So in the drawings on the left-hand side of the slide, this shows a syringe needle and also an evacuated tube needle. The syringe needle, or hypodermic needle, can only be used to collect the amount of blood that the syringe can hold. The multi-sample needle on the right-hand side of this drawing is used in the evacuated tube system. This needle type is capable of collecting many evacuated tube samples. And as you can see here, the evacuated tube needle or multi-sample needle is double-ended. Again, one end of the double-pointed needle enters the vein, and the other end pierces the top of the tube. The end that pierces the top of the tube is covered by the sleeve, as seen here in this drawing. And be aware that there is a needle under the sleeve, so avoid putting your finger onto it. This slide shows the multi-sample needle, which is used with the evacuated tube system. The evacuated tube system is, again, the most commonly used means of collecting specimens. It consists of a plastic holder, the evacuated sample tube, and a double-pointed needle. On one end of the double-pointed needle, this enters the vein, and then the other end pierces the top of the tube. Once the vein is punctured, the vacuum inside the tube aspirates the blood. The evacuated tube system reduces the risk of direct exposure to the patient's blood and has made it easier for phlebotomists to take multiple samples from a single venipuncture stick. The Needle Stick Prevention and Safety Act was created in the year 2000. This act revised the bloodborne pathogen standard in effect under the Occupational Safety and Health Act of 1970. This includes safer medical devices such as sharps with engineered sharps injury protections, needleless systems, and safety shields. Before using devices from different manufacturers, please familiarize yourself with how the device works before trying to use it on a patient. Needle holders are made with a clear, rigid plastic and are available with or without a safety feature. The needles may come pre-attached to the needle holder, or they can come separate. So the tube advancing line shows the point you should not advance the tube into the holder before performing the venipuncture. If you push the tube on the needle before the venipuncture, the tube will lose vacuum and you must discard it. The flared ends of the holder are used when changing tubes. The holder should remain attached to the needle and be discarded in a sharps container after the safety device is activated. The safety device must also always be activated as soon as you remove the needle from the arm against a hard surface, then dispose of immediately into a sharps container. You will activate the safety device while maintaining pressure on the collection site or while instructing the patient to hold pressure at that site. This safety device should not be activated with fingers or a soft surface such as a patient bed. It needs to be activated against a hard surface. This slide shows pictures of some examples of evacuated tube systems with safety devices. Notice in these bottom two photos, this is the correct way to activate a safety device. The safety device must also always be activated as soon as you remove the needle from the arm against a hard surface, then disposed of immediately into a sharps container. This is an example of a holder with a safety feature that retracts the needle into the holder. All needles and holders must go into a sharps container with the device activated. It does not make it safe for normal trash disposal. Here are two additional types of holders with safety devices. A sharps container is a rigid, puncture-resistant, sealable, and lockable container labeled with the words biohazard on it. This is what we use for a needle disposal system. These containers must never be filled above the designated mark. Remember, you should never recap a needle. Use the safety device to cover the needles to prevent needle sticks. And here's a picture of sharps containers. So there's a different variety of sizes of them depending on what facility you work in. They may have bigger ones, they may have smaller ones, but they all serve the same purpose.